Welcome to the deep dive. Today, we are tackling something that, well, it affects every single one of us navigating the healthcare system, your medical records.
hmm
We're going to unpack your rights regarding access, ownership, and control of this really crucial information.
And it sounds simple, doesn't it? I mean, it's your body, so it should be your data, right? But the reality is often quite a maze of regulations and tricky distinctions.
Yeah,
We're hoping to simplify that today.
exactly. I mean, how many times have you, or maybe someone you know, felt like you were just hitting a brick wall trying to get your own medical history? It happens a lot.
Oh, absolutely.
So our mission in this deep dive is really to arm you with clear, actionable knowledge. We've looked at federal and state rules so you understand exactly what your rights are when it comes to seeing and, managing your health data.
We'll be dissecting the difference between who technically holds the record itself and your fundamental right to the information inside it. We'll explore the power of federal laws like IPA and also the 21st Century Cures Act, which is more recent and quite forward-thinking.
Right.
And we'll look at the added layers from state laws, too. Plus, we'll give some concrete steps you can actually take to get your records and maybe even build your own personal health information hub.
Okay, let's dive right into a question that I think is probably the first thing on everyone's mind. When we talk about medical records, who actually owns them?
Yeah, that's the big one. And this is where we need to make a key distinction right off the bat.
Hmm.
In the vast majority of states, the physical record, the paper file in your doctor's office, or the digital data on their server that's generally considered the property of the healthcare provider or the facility that created it.
Hmm.
So, your GP's notes, the hospital's charts, the clinic's electronic files,
Hmm.
technically they belong to them.
Okay, but that doesn't quite sit right, does it? It's my health, it's my story documented right there. It feels like I should own it.
That's the intuitive reaction, absolutely. And it highlights a really crucial point. While they own the record medium, you possess significant rights to the information within that record.
Okay.
Think of it like a library book analogy I sometimes use. Imagine you borrow a really important book from the library. The library owns the physical book, right? It's part of their collection.
Sure.
But you absolutely have the right to read every single word inside it, learn from it. Similarly, healthcare providers have the responsibility to maintain your records accurately and securely, sure, but they also have a legal and ethical duty to make sure you can access that vital health information.
Okay, the library analogy helps. It makes that clearer. They manage the system, the books, but I have the right to know what's being said about my health inside those books.
Precisely. Now, just to add a layer, state laws can introduce variations here. For instance, New Hampshire actually has specific legislation that grants patients statutory ownership of their medical records.
Oh, interesting.
Yeah, it's an outlier. But in most other states, while the provider technically owns the record, your rights to access the information are very strong, particularly because of the federal laws we'll get into.
Got it. What about all the health data we're generating ourselves these days? Through patient portals or fitness trackers, health apps. Who owns that stuff?
That's a really, really relevant question now. Generally, the data you actively put in yourself, like steps tracked on your watch, blood pressure readings you log, notes about symptoms, that initial data belongs to you.
Okay.
However, once you share that information with your provider and it gets integrated into their official clinical record, say you upload your blood pressure log to the doctor's portal, it typically falls under that same provider ownership model for the official record. But again, with your strong rights to access it.
So even if I typed it in myself, once it's part of their official file, it's treated like their own notes, ownership walls.
In broad terms, yeah, for the ownership of that integrated official record. But what's truly significant, and I think the more important point, is that regardless of who technically owns the paper or the file, the overwhelming trend, especially driven by federal law, is to strengthen and expand your rights to see and use that information.
Right.
So focusing on understanding your access rights is ultimately much more empowering than getting too bogged down in the technicality of who holds the title.
Okay, that makes sense. So the key takeaway is my right to see my records. How does the big one, HBA, fit into this picture?
Right, HBA. The Health Insurance Portability and Accountability Act. It's foundational. It established the first real comprehensive national standards for your right to access your medical records.
Okay.
And it applies to what are called covered entities, which basically means most healthcare providers, hospitals, clinics, doctors, dentists, pharmacies, and also health insurance companies. If they handle your health info, HPA likely applies.
So pretty much anytime I've been to a doctor, a hospital, filled a prescription, HIPAA is in play.
Almost certainly, yes. Under HIPAA, you have this fundamental right to inspect, review, and receive copies of your medical records. That means you can ask to see them, read them over, and get a copy for your own use.
And how quickly do they have to get those records to me once I ask? Is there a deadline?
Generally, HIPAA says covered entities must fulfill your request within 30 days.
Okay.
They can get a single 30-day extension, but only if they give you a written explanation for the delay. Now, it's important to remember, like we hinted at, some state laws actually mandate faster turnarounds.
Right.
Could be 5 to 15 days in some places. And where state law is more protective or faster, that's the rule that applies over the basic IPAY timeline.
And with everything going electronic now, can I usually ask for like a digital copy?
Absolutely. HIPAA specifically requires providers to give you your records in the format you request if they can readily produce them that way electronically.
Okay.
So if your records are mainly digital, you have a strong right to get them electronically, which is often, much more convenient.
What about fees? I hear horror stories sometimes. Can they charge me a fortune just to see my own information?
No, they shouldn't. IPAY allows them to charge a reasonable cost-based fee. That basically covers the actual labor for copying and sending the records, plus supplies like paper or maybe a USB drive.
Right.
But they cannot charge excessive fees that would basically create a barrier to you getting your own health info. That's prohibited.
That's a relief. Okay, what if I actually look through my records and find something that's just clearly wrong, like factually inaccurate? Can I get it fixed?
Yes, absolutely. IPAY gives you a crucial right to request corrections, or amendments, as they're formally called. If you believe your records have inaccurate or incomplete information, you need to submit that request in writing.
Okay.
You have to be clear about what needs changing and why, maybe provide some backup documentation if you have it. The provider has to review it. Now, that they can deny your request. But if they do, they have to give you a written explanation why, and they have to tell you about your right to submit a statement of disagreement, which then gets added to your record alongside the disputed info. So your side of the story is still there.
Okay, that's good to know. And can I find out who else has been looking at my records? That feels pretty important for privacy.
Absolutely. HIPAA grants you the right to an accounting of disclosures. This means you can request a list showing who your protected health information has been disclosed to, other than for routine things like treatment, payment, or standard healthcare operations.
Mm-hmm.
It lets you see who's accessed your sensitive data, which adds a layer of transparency.
Are there any situations where my access under HIPAA might be limited, like things I can't see?
Yes, there are a few specific exceptions. A big one is psychotherapy notes. These are the personal notes a therapist takes during counseling sessions and keeps separate from your main medical record. Those generally aren't covered by the same broad right of access. Also, information that's been specifically put together, in anticipation of a legal proceeding might have some access limitations too.
And if I feel like a provider just isn't respecting my HIPAA, they're blocking me or charging too much, what can I do?
The enforcement arm is the Office for Civil Rights, or OCR, within the U.S. Department of Health and Human Services, HHS. If you believe your HIPAA rights have been violated, you absolutely have the right to file a formal complaint with them. They investigate these things.
Okay, good to know there's recourse. So HIPAA sets this national floor like a minimum standard, but you mentioned state laws can build on that. How does that work in practice?
Exactly. Think of HIPAA as the baseline. State laws often go above and beyond, giving patients even stronger rights or more specific rules. Like we touched on earlier, many states have much shorter time frames for providers to give you your records.
Right, you said maybe 5 to 15 days sometimes.
Yeah, some are significantly faster than HIPAA's 30 days. Also, fee structures can vary a lot by state. Some states have very specific rules about how much providers can charge per page, or they set up detailed fee schedules. California, for example, has maximum fees that get adjusted each year based on the Consumer Price Index, so it's a clear framework.
What about really sensitive information? Things like mental health records or HIV status. Are there usually extra protections there under state law?
Generally, yes. Most states have passed laws with heightened privacy and access protections for information considered particularly sensitive.
Like what?
Things like records about mental health treatment, substance use disorder treatment, HIV/AIDS status information, genetic testing results,
Right.
that kind of thing. These state laws often require very specific, explicit patient consent for any disclosure, often going further than IP's general rules.
Okay. What about kids? Can parents just automatically see all of their minor children's records? That seems like it could get complicated maybe with teenagers.
It is a nuanced area, for sure. Generally, yes, parents do have the right to access their minor children's medical records.
Okay.
However, state laws often carve out important exceptions, especially for what's called confidential care. Many states allow adolescents, teenagers, to consent to and receive confidential care for certain services without parental notification.
Like what kind of services?
Typically things like reproductive health services, substance abuse treatment, and mental health services. In those specific confidential care situations, the state law might prevent parents from accessing those particular records to protect the adolescent's privacy.
Okay, that makes sense. So if a state law gives me more protection or a stronger right than HIPAA does, that's the one that counts.
That's the core principle, yes. When
Oh.
there's a difference between federal and state law on patient rights, the law that provides the greater right or the stronger protection to the patient is the one that generally prevails.
Okay.
It creates a bit of a patchwork across the country, yeah, but the goal is usually to ensure the highest level of patient rights applies.
Did things change much with these rules because of the COVID-19 pandemic? I remember lots of healthcare rules seemed to shift temporarily.
Yeah, during the height of the pandemic, there were some temporary tweaks, especially around telehealth records and faster information sharing for public health emergencies.
Right.
But the vast majority of those temporary changes have now expired or reverted back to the standard pre-pandemic rules. So we're largely back to the established HIPAA and state law framework.
Okay, so HIPAA and state laws establish my right to ask for my records and set some rules around that, but I've been hearing a lot about this 21st Century Cures Act. How does that fit in? It sounds like it might be a pretty big deal.
Oh, it is. The 21st Century Cures Act, and specifically its information blocking provisions, which really started kicking in around 2021, it's a truly significant development. It fundamentally shifts the paradigm.
How so?
It moves things from you having to request your records to healthcare providers being required to proactively make certain types of electronic health information readily available to you. It's a big change in thinking.
Information blocking. That term sounds a bit negative. What does it actually mean here?
Yet, it sounds a bit like they're doing something wrong. But it refers to practices by healthcare providers or even health IT developers that unreasonably interfere with your ability to access, exchange, or use your electronic health information, your EHI.
Okay.
The goal of the rules is basically to stop the intentional withholding of electronic health information that patients should rightfully have easy access to, breaking down artificial barriers, essentially.
So instead of me filling out forms and waiting maybe weeks, they're now supposed to be making it easier for me to get my electronic records, like right away without the hassle?
Precisely. Under the Cures Act, providers are now legally obligated to make specific categories of electronic health information available to patients without delay. This includes really crucial stuff like consultation notes, discharge summaries from the hospital, your history and physical exam documentation, lab results, path reports, medication lists. Quite a bit, actually.
And this is a key difference from IPA, right? Because IPA is about my right to ask for it. The Cures Act sounds like it's about them pushing it out to me.
That's the critical distinction, exactly. IPA-O focuses on your right to request access. The Cures Act mandates proactive sharing of a defined set of electronic health information, usually through patient portals or similar secure electronic means. It's a big push towards greater transparency and immediate access.
Are there any legitimate reasons why a provider might not have to share this info immediately under the Cures Act? Are there exceptions?
Yes, the regulations do spell out a few specific limited exceptions. These are pretty carefully defined.
Like what?
Things like, if sharing the information could reasonably be expected to cause substantial harm to the patient, or someone else, that's the preventing harm exception, or if it's necessary to protect an individual's privacy, like if the record contains sensitive info about someone else.
Okay.
Also, protecting the security of their systems, or if providing access is genuinely infeasible due to technical limitations beyond their control. But these exceptions are meant to be used narrowly.
And what happens if providers don't follow these new rules, if they are information blocking?
There can be significant consequences. Healthcare providers found to be intentionally engaging in information blocking can face penalties, potentially including substantial monetary fines for certain types of organizations. It creates a pretty strong incentive to comply.
I have definitely noticed a change in my own patient portal recently. Test results seem to pop up almost instantly now, sometimes even before my doctor has called me about them. Is that likely a direct result of this Cures Act?
It is very, very likely, yes. The information blocking rules have been a major driver behind that increased speed and availability of electronic health information through portals. What you're describing is probably a direct outcome.
Yeah, and while it's great for transparency, I can also see how getting, say, a complex or maybe concerning test result without any context from my doctor first, that could cause a lot of anxiety for patients.
That's a very valid point, and it's a big discussion happening right now. While immediate access definitely promotes transparency and empowers patients, it absolutely brings up crucial questions about how best to deliver sensitive information and the ongoing need for good communication between patients and providers.
Right.
It's a landscape that's still kind of shaking out.
And is this trend of proactive sharing likely to continue? Will we eventually get real-time access to even more of our health information?
The intent of the Cures Act is certainly for this to expand. Future phases of the regulations are expected to include even more categories of electronic health information that providers will need to make readily available. The push is definitely towards a more open and accessible digital health ecosystem.
Okay, this is all incredibly valuable to understand. So let's get practical. If I, or one of our listeners, wants to actually get a copy of their medical records, what are the steps they should take? Let's walk through it.
Right. The very first step is to figure out exactly which records you need and who has them. Remember, your health information might be spread across different doctors, specialists, hospitals, labs.
Yeah, my primary care doctor, maybe a specialist, the hospital I went to last year.
Exactly. So identify the source first. Then, the easiest starting point these days is often the patient portal, like we just discussed.
Okay.
Check there first. You might find a lot of what you need: recent visit summaries, test results, med lists, maybe even notes available instantly.
But what if the records I need aren't on the portal? Or maybe it's an older record, or the provider just doesn't have a good portal? What then?
Right. In those cases, you'll need to submit a formal written request. Most providers have a specific medical record request form. You can usually get this from their office, download it from their website, or ask the medical records department directly.
And if they don't have a form, can I just write a letter?
Absolutely. If there's no specific form, a clear letter works just fine.
What absolutely needs to be in that request, whether it's a form or a letter, to make sure it gets processed smoothly?
You need to include your full legal name, your date of birth, and your current contact info, phone, and mailing address are good. Then, be as specific as possible about the exact records you need.
Like, not just my records, but maybe records related to my knee surgery in June 2023?
Exactly. Specify the type of records and the date range. Also, state your preferred format: paper copies mailed or electronic files on a CD, USB, or maybe through a secure download link if they offer that.
Okay.
And if you happen to know your patient ID number with that provider, definitely include it. That helps them find your file faster.
Is it generally better to just ask for everything, my entire chart, or should I try to be more targeted? Does it make a difference?
It often makes a big difference. Requesting everything can sometimes slow things down and might result in higher fees if fees apply.
Ah.
Being specific about what you truly need, like just the records for a specific condition or a specific time frame or maybe just lab results, can often get you the information faster and potentially at a lower cost.
That makes sense. If all I really need is my childhood immunization record from my old pediatrician, I should just ask for that specifically, not their whole file on me.
Precisely. And think about prioritizing too. If you've seen multiple providers, maybe focus first on getting records with unique information that isn't likely duplicated elsewhere, like detailed surgical reports from a hospital stay or specialized test results.
Good tip. What if the records I'm looking for are really old, like from 10 or 15 years ago? Does that change things?
It might. If you need records older than, say, 5 to 10 years, it's probably a good idea to contact the provider's office or medical records department early. Older records might be stored off-site, maybe even on microfilm or older systems.
Microfilm. Wow.
Yeah, it happens. So it can sometimes just take them longer to retrieve those older files. Give them a heads up if you can.
Okay. Now, what if I send in my request, I wait the 30 days, or maybe even the shorter state time frame, and I hear nothing? Or what if the provider seems reluctant, or they're making it really difficult? What are my next steps?
If you hit resistance or significant delays, don't just give up. Escalate the issue systematically. Your first step is usually to contact the supervisor within the medical records department.
Okay.
If that doesn't work, try reaching out to the facility's privacy officer or their compliance department. These roles often exist specifically to handle patient rights issues.
Right.
Many hospitals and larger clinics also have a patient advocate or patient relations department. They can be really helpful liaisons. And if needed, you could contact the general administration of the facility.
And if I go through all those internal steps and I'm still getting nowhere, what's the final recourse?
If you continue to face significant barriers after trying to resolve it directly with the provider, your ultimate recourse is to file that formal complaint with the HHS Office for Civil Rights, the OCR. You can usually do this online through their portal. They take these complaints very seriously and have the authority to investigate potential HIPAA violations and compel providers to comply.
Good. And just to circle back quickly, if I find an error and want it corrected, that's a totally separate process from just requesting a copy, right?
Yes, absolutely distinct. Requesting an amendment or correction requires its own separate written request. You need to clearly identify the specific information you think is wrong, explain why it's wrong, propose the correction, and provide any supporting documents you have. It's a different workflow.
Got it. Okay, this has been incredibly helpful for understanding how to get records from my providers. But what about taking a more proactive approach? Managing my own health story. What's the best way to keep track of everything myself in a personal health record?
The personal health record, or PHR. Creating and maintaining your own PHR is an exceptionally valuable thing to do. It really empowers you. It centralizes your key medical information in one place that you control. This makes it readily accessible, especially in emergencies or when you're trying to coordinate care between different doctors who might not always talk to each other effectively.
Right. What are some of the best ways to actually do that? Are we talking digital apps, or is a good old-fashioned paper system still okay?
You know, there are benefits to both, and the best choice really depends on your personal preference and comfort level with technology. Digital options, dedicated PHR apps, secure cloud storage, even just well-organized folders on your computer with strong passwords offer convenience, easy searching, maybe secure sharing features.
But security is key there.
Absolutely critical. You need to prioritize security and privacy with digital tools. But for people who prefer something tangible, a simple 3-ring binder can be surprisingly effective.
Really? Like with dividers.
Yeah. Get some dividers, label sections clearly. Maybe medications, test results, doctor visits, provider contacts, insurance info. Keep a summary page at the front with key info, like chronic conditions, allergies, current meds. It works well for many people.
Okay. Whether it's digital or paper, what are the absolute essential pieces of information that should be in my personal health record?
At a bare minimum, you want a comprehensive, up-to-date list of all your current medications, dosages, frequency, everything. Your immunization history, summaries of major surgeries or hospital stays, a clear list of all known allergies and any bad reactions you've had, info on any chronic conditions, and definitely easily accessible emergency contact information.
And how often should I be updating this to keep it useful?
It's best to make it a habit.
Huh?
Update it regularly, ideally after any significant healthcare event like a doctor's visit where your meds change or you get a new diagnosis, or after a hospital stay.
Okay.
And try to keep things organized chronologically within each section, maybe newest info on top. That makes it easiest to find things quickly.
And should I think about sharing this, maybe with a spouse or a family member?
Absolutely. It's a really good idea to consider sharing access to your PHR with trusted family members, especially someone who might need that information in an emergency or who helps with your healthcare decisions.
Right.
Many electronic systems have secure sharing features. If you use paper, maybe make a copy of the key summary pages and ensure your emergency contact knows where to find it.
This has truly been a deep dive, hasn't it, into a topic that's, well, it's far more intricate than I think most people realize. To kind of bring it all together, what are the most important takeaways you want our listeners to hold on to?
I think the most crucial thing is to remember that you do have significant legal rights regarding your medical records. Both the right to access the information your providers have and the right to request corrections if something's wrong. Exercising these rights is fundamental. It helps you make informed decisions about your health, ensures better continuity of care. Don't hesitate to assert these rights when you need to.
And it's not just some abstract legal right, is it? It's a really practical necessity for being an active participant in our own healthcare.
Precisely. And remember that taking the initiative to create and maintain your own personal health record, your PHR, is a really powerful complementary strategy. It puts you even more in control, regardless of where you get your care.
For this discussion, we've drawn on a range of really solid resources. Things like official guidance from HHS on HIPAA access, materials from the ONC, that's the Office of the National Coordinator for Health IT on information blocking, and the Cures Act, the Health Information and the Law Project for state law details, practical advice from the Patient Advocate Foundation, Akima's consumer guides on PHRs, and even articles from the Journal of AHIMA looking at access challenges. We definitely encourage listeners to explore those if they want to go even deeper.
Yeah, lots of good info out there. And on our next deep dive, we'll be shifting gears a bit, focusing on practical strategies for having more effective communication with your healthcare providers, especially when appointment times feel so short.
Always a challenge. Until then, maybe take some time to consider how you can leverage what you've learned today about your rights and these tools to become a more empowered, more informed participant in your own healthcare journey. Thanks for joining us for this deep dive